Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson, and as always, I am joined by RipsyTech Founder and CEO, Tom Tarshis. Hey, Tom.
Hey, Parker. Nice to see you.
Good to see you, too. So today we've got an interesting topic that we wanted to talk about. This is a topic that pertains a bit more to the therapeutic process, more so than the business process. So a little change of pace, but I think this is a great, really interesting topic that you thought up for us today, which is self-disclosure in therapy. How much should your patient know about you as a provider?
Yeah, and I think, one of the things about the behavioral health field, or if you're going to be a clinician in this field, is there's a long and interesting history of how this field started, how it evolved, how society changes, how stigma changes, belief systems based not on science and then getting more science. And it can be complex and interesting. And yeah, it's not... I was listening as you did the intro, that it's maybe not one of our usual sort of business topics. But then again, if you're talking about ethics or legal issues or boundaries, it is something that can come into play in your practice as a solo practitioner in a group. And so everything is sort of connected, adjacent connected to the business practice. But I think we'll try to bring in some more of these. There's no actual real right answer to a lot of these things, but just to talk about what I've seen and what I've done over the years and get other people's opinions as well.
It sounds great. I mean, I'm excited to explore more of these types of topics. I think it really kind of opens the floodgates to all kinds of things that we could talk about. So let's dive into this one specifically. First question, how should a mental health provider determine what kind of personal information, if any, is appropriate to share with their patients?
Yeah, and I'll say, it's such a great topic with how the world has changed, especially with social media, marketing, advertising, and the fact that we have the internet where you can put someone's name in and may be able to pull up lots of information. Mm-hmm. If we go back to even when I was beginning my training after medical school, which was the early 2000s, and my residency program had very good psychoanalytic training on performing psychotherapy. And one of the general principles of this training is really don't disclose anything about yourself to your patients. That you should be a blank template for them to project their own feelings, thoughts about, and that you could use information that they think about you as part of understanding who the patient was and making progress in their treatment. And to me, I'm pretty socially out there. I'm not a very private person. To me, it felt awkward if someone asked how old I was or if I was in a relationship, to instead of answering it, to just always say, well, why do you want to know? Or how old do you think I am? Which is, and again, there's lots of people go through lots of different trainings and have lots of different reasons, but right. That was what I thought that's what you're supposed to do. And then life is life, and you do sometimes see patients outside, and then you were also taught to not acknowledge your patients. And there are, well, we can come back to that topic a little bit, but a lot of that training for me specifically didn't feel great, but I would say that in general, it's still the norm, or that there is an emphasis around don't share very much information with your patients if you're a mental health practitioner. And that's what brings this topic on my mind. And I think when we were even coming up with topics this week, there were a couple experiences with patients this week, where there's still that feeling that when you come into a therapist's office and shut the door, that is very private, confidential, and it makes some of our patients even scared to ask what's going on in treatment. So if you think about it as a patient, if you've asked your clinician a personal question and they haven't answered it, how does that make you feel about saying, I'm actually not really feeling much better, or I don't understand what we're doing in therapy? And I had a couple of those experiences with new patients this week that I felt bad for them being scared to ask questions. And so I think that is why it's on my mind a little bit. But I'll pause there before I continue. Yeah.
Yeah. So like struggling to connect with another human being if you can't really interpret their presence in front of you as another human being. I think that's a really great point. I think every therapist I've ever encountered, I did know some amount of information about them, at least whatever information felt relevant to me. I think when I worked in IOP programs, where it was more of a behavior specialist, bachelor's level, not glorified camp counselor, but something slightly above that, where I wasn't beholden to, I guess, some of the, I don't know if red tape is the right word, but some of the things that maybe somebody who has a license is a bit more worried about. So I think in those interactions that I had with like youth, it was a bit more comforting for somebody who was like young like me, who was not necessarily the therapist, to be able to self-disclose certain things about themselves. I mean, there's always a limit, but that definitely felt like, it was my job to connect with teens, be kind of for lack of a better way of putting it, like a beacon of light in a dark time, and just kind of be like a cool young positive role model. So and self-disclosure, I think, really came in handy with that, being able to relate to other people's experiences, but ultimately keeping the focus on them as often as possible. So yeah, that makes me consider that experience as, I don't think it would have been as useful if I hadn't had the freedom to self-disclose some things.
Yeah, no, and you're right, and being like so close in age, yet being 20 or 21 when someone's 16.
I was like 23. I wasn't that young.
But, fair enough. But there's an age range, and yeah, your role is like you're the same generation. You're successful. It's easier for a 16-year-old to connect with a 23-year-old behavioral specialist maybe than a 50-year-old psychiatrist, or it's a different relationship. And all our group of behavioral specialists all had proper boundaries to like, yeah, here's my cell phone. What are you doing Friday? Like, no, like not okay. But yeah, I'm in school or graduate school or sharing stuff about when you were in high school, or even your own, own people sharing their own mental health symptoms is powerful. And yeah, and I, working with kids, I'd say that it's always feels especially ridiculous if a 8-year-old asks you, do you have kids, or do you have a pet, or how old are you, to like, why do you want to know? Like right. These are straightforward questions that I think not answering directly can hurt the therapeutic relationship. Right. And so it's sort of a, the specific question was what is appropriate to share with patients. It depends on a lot of factors, but if a lot of it mainly depends on, how you've been trained and what you're comfortable with. And I think that there's a lot of fear-driven training that happens in the field with all types of mental health clinicians. And I think that people, at this point in my career, I feel pretty comfortable sharing, almost any demographic piece of information, that I have 5 kids, what their ages are, sexual orientation, in a relationship, been divorced. And I think that being able to share all of that information, number one, lets people know that, hey, just humans, there's no like superpowers here. I mean, maybe with technology or research, but just, in general. And then, and it can build that relationship. But then it's also the reason to share a lot of that information. And one of our approaches to treatments is, remember, we're a team here. I'm just someone who's had some training, but I have my life also. And there's not a secret thing that happens behind this door. We're going to be, here's the plan that we're on. And if it doesn't work, we'll change it around. But so I really feel that when you're refusing to share a lot of information or very rigid about self-disclosure, it does make it feel like it's less of a team and that you're working with someone on their mental health. And I don't like that imbalance in that relationship. I don't feel there should be a power imbalance in a treatment relationship. And that's why I go by Tom with all my patients also, which, not most people don't do that, but that's just something I do. Yeah.
Yeah, I mean, I'll still refer to you as Dr. Tarshish, just as a brief term of endearment. Just give you your flowers as deserved. Well, I want to touch on something that you said earlier about how it's easy to really search up somebody and find out a lot of information on them, and I feel like this is something I encountered with people that I know who went on to become therapists or past coworkers that I had. If they sent me a friend request on Facebook, it was like their last name might have been changed, or something to hide their identity a little bit from being searched up. I think when I encountered the only time I ever kind of encountered an issue with that was when one of the patients that we were working with had looked me up, and I wasn't a therapist. I'm a social guy. I like to post reviews on my social media. I'm a bit more closed off now, I think, unless you check my LinkedIn account. But I had a moment where somebody that we were working with looked me up on Facebook, and then they were able to find out, details about my relationship, and they would share. This is like a teenager, and they're sharing that information with the rest of the group. Like, oh, Parker's girlfriend is so pretty and looks like this, and her name is this. And I think that for me was a little uncomfortable, but it was also an opportunity to, I guess, identify maybe what was making me uncomfortable about that behavior and have a conversation with the patient. I mean, they're there to work on themselves and trying to find a way to, talk about it as a growth opportunity, and then also maybe go find that patient on Facebook and block them so that they can stop looking me up.
And that actually, Parker, it's a great story, and it does draw, some things are a lot more black and white, and it's, it is not a good idea to be Facebook friends with current or former patients. That, definitely current patients, that's feels like something that can get your license in trouble. Maybe not. And even with former patients on a social platform like Facebook, definitely doesn't feel appropriate. That being said, something like LinkedIn, which you mentioned, I don't think it's inappropriate for I wouldn't necessarily block a former patient from following a professional profile that we make sure is very professional and doesn't contain any sort of content that could be, I don't know, evoke strong feelings or emotions or opinions. So,
yeah. I mean, I think in the case of my example, I definitely was not trying to be connected with, any patients on any level on any social media. But, I mean, I think definitely when it came to something like a Facebook or an Instagram, it definitely made me consider my privacy settings. I mean, now I have, like I said, I like to post reviews sometimes on my Instagram, but that's a separate account that I've created just for that sole purpose. Nothing about my personal life goes on there, but it's a public account. And then I have my private account that only people I know follow me. Only people who follow me can see what I post, that kind of thing. And I think I do that because of that past experience. And I feel like a lot of people who do work in mental health probably do go more, the private social media account route. But yeah, to your point about LinkedIn, that's inherently, it's a public, everything's public about you. So I think that makes a lot of sense that, it could be to your benefit to be connected with a past patient, especially if they're doing really great and maybe they're a little bit older and you remember you worked with them a long time ago and they had this skill set that they were interested in, and I don't know.
Yeah, no, and a lot of, again, the mental health field is so popular now, and a lot of people who've gone through depression or mental health treatment and are now in the field, like these are, former patients can be colleagues. And so, well, and you bring up another good point around self-disclosure, which, all clinicians should Google themselves and see what is out there. And it just assume your patients have Googled you. And so if you can find out you're in this relationship, or, whoa, this photo is public from a long time ago, at this beach party, well, I better figure out how to get that down. But don't be, I think it's illogical that something that's easily Googleable that you wouldn't disclose in a session with a patient if they asked, and something like that could hurt the relationship.
That's a great point. Well, let's to keep the ball rolling on some of our questions here. I want to talk about how things have changed over previous decades. You touched on this. No, we might have actually covered this to a good degree. I guess the question that I would have of, how self-disclosure has become a bit more appropriate now, I guess what key factors do we feel like drove those changes to us being more open? Because, at a human level, it is easier to connect when somebody knows more about you, but I guess maybe why is that more relevant today than it was before?
Yeah, no, good question. And I think it's a two-part answer. Number one is that it was real that even 20 years ago, but certainly 40 or 50 years ago, if you were getting any type of mental health treatment, that could have severe consequences for your job, for family and friends, for your workplace. So where stigma was at, if people knew you were seeing a psychiatrist or a therapist, people were fired over things like that. And so there was a real piece from the patient side that made, we need to be a little more secretive about the care. We need to make sure you're not advertised all over the place, because the more you're advertised, and the more the patients that work with you might face some exposure. And so the decrease of that stigma and people being more open about mental health and the pandemic and all of that piece, I think it is not shameful any longer to see a therapist or a psychiatrist or anyone in mental health and get any sort of mental health treatment, which has been positive. And then the other piece has just become that, the way you get business now has changed from how it used to be previously. And so in general, having a successful business, the way the whole world has changed with online reviews and other pieces, it means that when you put yourself out there and are open and encourage some more of the marketing and feedback and reviews, it's going to be better for your business also. And even though ultimately in this, as a helping profession, you want to be successful business wise, which is what we talk about often. So the pros of putting more information about yourself out there and having more data available outweigh any potential risks that come along with that.
Yeah, well said. Well said.
The other like interesting tidbit fact there is it's, some of the, the old time psychoanalysts would often have an office at their house. So you have this sort of shield on like disclosing personal information, yet you had patients coming to this like extra unit on your house, like they could see your
kids. I wonder about that
kids,
sometimes. I think, gosh, I watched a movie recently, Girl Interrupted, which is a good movie, but it takes place in the 60s, and I remember I believe the main character was seeing their provider at their psychiatrist's house, and I couldn't help but think that seemed so wild to me that a psychiatrist would feel comfortable doing that. I want to say they do that in the first season of American Horror Story as well, which, I just thought that was, well, they had fun with it when they wrote that show. But yeah, that always seemed, I guess as a follow-up question, is that common today for people to do that? Or what is it? With telehealth or having an office, it's just that's the expectation that you do that.
That's a great point. I mean, a lot of people do work at home now. I think the majority of therapy visits are via telehealth now, which is a drastic change from pre-pandemic. But I do still know some practitioners that have their home office that patients come to live. It is a great business deduction if you can take advantage of that. If you really have a separate, as anyone who does any business out of their home, it can be a great tax advantage. I think it does come, like if you're a clinician that works with, more extreme cases of maybe bipolar disorder, schizophrenia, people with psychosis, I think that's not necessarily the people who have the home office practice. I think it's more depression, anxiety, ADHD, a little more straightforward cases that I know that there was once in my training, there was someone who got my home address from property records, who wasn't really my patient, but when I was working in a hospital in my residency, my name was on some court documents, and they had sort of gotten everyone's personal information and sent threats out to them. And so,
wow,
it's no one likes to be sent sort of a veiled threat letter by anyone. But yeah, so there are people who still do the home practice. I think there's a certain clientele that those people have where they're not going to feel threatened by that.
Well, that makes a lot of sense. So then in that case, keeping on the topic of self-disclosure we've talked a lot about how it might be helpful, and maybe there's more to say on how it might be particularly helpful to self-disclose, but in what ways might it also be harmful to the therapeutic relationship?
Yeah, and I think, Parker, you actually touched on this a little bit with your story, but therapy is for your clients, not for you. And if you get too comfortable with self-disclosure or saying things about your life, you don't want it to become a therapy session for yourself. And definitely known patients where it felt like the therapist or psychiatrist or psychologist was speaking more than they were in sessions, and that's a little bit of a red flag warning. There are clear guidelines around you need to not do anything in business with any current or former patients. You need to be careful around, if you said, I'm looking to invest in a company, and a patient says, ooh, there's this new tech startup, you should put your money there. Those sorts of things are off limit, and you probably shouldn't be talking about investing money either.
Makes sense.
So you've just got to watch reasonable boundaries. And let's see, for example, today I think we were talking about family went out to breakfast, and it's like, you ask the kid where was breakfast, and then mentioning, I've been to that place or not been to that place, or having a quick discussion on restaurants you like shows a good relationship, and it's therapeutic and pretty public. And but it gets different when you're talking about more personal topics.
For sure.
You just got to be very careful about those pieces.
Yeah, I was always comfortable talking about like a movie or a video game or a TV show, assuming it was all, age appropriate content. But yeah, I mean, details about my personal life were always like, just try to not necessarily deflect the question, but, well, I guess deflect the question. Just or either deflect or just, be upfront about why I feel uncomfortable answering the question, and then just, change the topic to something else. Well, okay, let's see. Can you share any other examples of how... Well, let's talk about how self-disclosure might actually be different based on demographics. So that could be the patient's age, cultural background, or just the nature of the therapy that's being provided. How might self-disclosure change in those contexts?
Yeah, and it's a great question, and one of the hallmarks of the training is don't assume because you're the same age or sexual orientation or think you're the same culture that is actually true, or that automatically means you have a shared experience or shared beliefs. And the idea is you're going to approach all of these items with kind of thoughtful curiosity and let the patient drive the conversation around those pieces. And there is if someone's had a awful experience because of one of these traits that you've experienced yourself, or I think that it's reasonable to, depending on the nature of the relationship and other pieces, it might help the relationship for someone to know that you've been through a similar situation. There are a lot of people who will ask for providers with certain features or characteristics that the patients feel match them to help them understand better.
Right.
We, there are awful stories though where people have assumed certain things, and it was you hear these stories and you sort of shudder at how someone would do this. And one of these stories I can relay is a good friend of mine who I trained with worked as an interpreter before they finished their training in psychiatry, and they were interpreting for a war refugee who was having a session with a psychologist, and the psychologist had made a comment around trying to let the patient know that he knew what he'd been through because he had a parent who beat him when he was growing up. And the patient was like, my friend who was interpreting was shuddering at this, but he was like a good interpreter where you translate word for word. And the war refugee was like, I had great parents. What are you talking about? You don't know. So like trauma does not equal trauma. Like your experience does not equal someone else's. And that story has always been powerful in passing that information on to trainees I work with or just in my own education. So if you've got a shared experience, that you think will help let the patient know that you really do know what they're going through, that's great. But otherwise, you're just going to express the empathy and let them tell their story, and be there as a support.
Yeah, what a great story. And I fully agree with all of the takeaways. That's good stuff. I was trying to think of a specific example, if any, that I might have had from my time of working in IOP. The only thing that for me really came up was, we had a teen who was really into video games and didn't really feel understood by their parents and liking video games, and they really liked this series called Persona, and I was a pretty big Persona fan. So when they had kind of like let the group know, like, oh, I'm really into this thing, but my parents don't really understand it, for me to say, oh, I'm actually a pretty big fan of that, and I think it's awesome. That was like a good opportunity for them to feel like, oh, this thing that I like is, not weird. And, to a degree, for me, even, it's almost like validating to me to know, like, oh, okay, somebody else likes this thing too. But, being able to recognize that and say, like, okay, well, I'm not going to then get into deep dive conversations with this patient about this thing, because at the end of the day, we're here for them to work on themselves as part of treatment, and not for me to connect with somebody else that likes Persona. But if they come and ask me questions, then I'd be happy to talk about it, as long as it's in service of their care.
Yeah, it's such a great comment that's like a powerful therapeutic effect to validate that kid, and it's going to engage them in treatment better. And that's just such a perfect example of where a little personal self-disclosure can have a really powerful positive effect. Perfect.
Yeah, thanks. Yeah, it was a fun job. All right. Well, let's see. Well, very, very rewarding. Very, very, very rewarding job. So just to finish things up here, let's talk about, gauging the impact of your self-disclosure. What steps can you take if you believe that your self-disclosure is affecting the therapeutic process?
Perhaps there has been a little self-disclosure, and then you have a patient that maybe has misinterpreted that, or who feels like, oh, this therapist or this doctor, they want to be friends, or they want to hang out, and then they find your address, or they get your personal cell phone number and start texting you often. It's usually very clear when the any self-disclosure you may have done has led to the patient thinking that it's something other than a professional relationship. Usually just a conversation about it will solve it. And there can be some exploration around that. And that it's not an uncommon thing to happen in this field. In general, if you look at the medical board for any given state, the most often reason why doctors are reprimanded or get in trouble with their license is for going too far with self-disclosure or relationships, which I think is second to substance abuse. And I think it's similar for other licensing boards. So just be very careful, depending on your patient, about what you want to do with that self-disclosure. And at the slightest hint of someone taking things too far, you need to have a conversation about it and stop it. And this goes for current and former patients. So there are lots of stories where a clinician fell in love with a patient, and then they're like, oh, well, I'll just transfer them to someone else and do this relationship. And that is definitely a big no, and we'll get in big trouble. But make no mistake, that stuff does happen. And
I think there was an episode of How I Met Your Mother where something like that happened, where one of the characters went to therapy that was like court mandated, and then by the end of their court mandated therapy, their provider asked them out on a date, and it was like not treated as that weird of a thing, but definitely, I think when I watched, I was like, that's not right. And definitely looking back on it, I'm like, there's just no way. That's too.
Well, it is. Yeah, I think it is romanticized in film. I think there is this, the 50-50 movie with Seth Rogen and
Joseph Gordon-Levitt and
Joseph
Anna
Gordon-Levitt.
Kendrick.
They, you wouldn't be they wound up in a relationship. There was the gangster movie with Matt Damon and Leo DiCaprio.
The Departed.
And Jack Nicholson. The Departed, where that psychiatrist, got into relationships with both of them. So it is. And there's a great movie with Jude Law, Side Effects.
I've seen all of these movies.
So it is something. It is a theme. It must be something people think about. You could see where it's there could be a lot of movie fantasy content around that, and that has played out. So,
interesting.
Self-disclosure can be helpful, but know who you are and know who your patients are.
Yeah, well, that's a whole other topic we could talk about. Depictions of providers in film, the good and the bad. Definitely all of the ones getting into relationships with their patients. Definitely falls on the bad. Don't do that. Okay, well, great. Let's move on to mental health business moment of the week.
Yeah, and I think for our nonprofit that we've restarted operations, I had just been handling all of the billing myself, and thanks to RipsyTech, our EMR, it had not been too burdensome, and we have automatic explanations of benefits and automatic payments deposited. But I did make the decision to reach out to a colleague and someone who worked for me previously to bring them on for a few hours each week to take over the the double checking of the system and a little bit of communicating with patients. And I'd say that it's been just great to recognize that help and the value, even if it's 1 or 2 hours a week of my time. It is definitely cost effective for me to be seeing patients in that time and hire someone else to take care of some other work. And so it's been nice for me knowing I have someone else who's well trained and can deal with all of these little hiccups that, no matter how good your software system is, are still going to happen in the industry. And so just something for other small practices or people to be aware of, that if you're, whatever's going on with the billing and admin pieces, maybe check your software, but then maybe it's worth having someone hired to take care of it as well.
Well said. And I think your point about how ultimately it provides you opportunity to see more patients and collect more money, and that the cost pays itself back to be able to hire somebody. I think that's really well said. And we talk about the idea of maybe doing a special guest episode where we bring on somebody who's good with billing and finance pertaining to mental health practices, and can speak to what a good billing and finance person should know, or what their skill set looks like, what their experience might, what types of experiences with billers would be good for when you're choosing to bring somebody on. So, hopefully we make that happen, and I think that would make a great topic.
Yeah, indeed.
All right, well, there you have it. I think let's go ahead and wrap up the episode.
Sounds good.
All right. So thank you for joining us on this week's episode of the Sit and Stay podcast. Podcast brought to you by RipsyTech. If you have questions you would like to submit to our audience Q&A, or are interested in featuring as a guest on the show, send us an email at sitandstay@ripsytech.com. All right, Tom, I will see you later.
Thanks, Parker.
Bye.
Soon.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.